We are back here on CBS Mornings at 7:30 with some new research out today showing a big increase in the percentage of Americans receiving mental health treatment during the pandemic, which I actually think is good news. The CDC study shows that more than 23% of adults 18 to 44 years old received treatment last year, and that is up from 18.5% in 2019. The pandemic also saw an explosion of mental health apps and online services, which people find convenient, but there can be drawbacks. Our consumer investigative correspondent Anna Werner has been watching the industry closely and has more of her investigation into one of those companies. Anna, good morning.
Good morning, Tony. Yeah, earlier this year, we told you about Cerebral. It's a company that offers affordable prescriptions and therapy for conditions ranging from depression to bipolar disorder. Since then, we've heard from more patients and employees who are concerned about the way Cerebral diagnoses and prescribes medications, including one woman who says Cerebral mishandled her case with nearly fatal consequences. A warning, this story discusses suicide.
The woman we'll call Yvette says she's long suffered severe depression, a result of sexual trauma in her youth.
I was constantly depressed. It was just like this sadness, a sorrow that would just take over.
She says she struggled to afford therapy, but then she saw ads like these.
My poor mental health was pushing everyone in my life away until I started using Cerebral.
The ads from mental health provider Cerebral promised affordable prescriptions and therapy all online.
I thought I was honestly signing up for something that was going to change my life in a good way.
So she joined, first going through an assessment like this one. Then the system matched her with a prescriber.
And the first time I talked to the prescriber, it's only about 10 to 15 minutes.
Yvette says in that first roughly 15-minute appointment, she was prescribed 3 medications. And in a second appointment, equally brief, she was given 2 more, 5 drugs in all. But she says her symptoms got worse, and she contacted her Cerebral prescriber to tell her she was having nightmares about hanging herself.
And I was scared. And when I reached out to her and I was just crying to her because I didn't know what to do, she said, I don't have enough time. I have to go to my other appointment. I've already spent enough time with you.
The next day, a family member found her hanging from a dog leash in her bathroom.
I thought I was dreaming. I thought I was dreaming, but I was hanging and I didn't remember anything.
Would you, as a psychiatrist, be comfortable diagnosing someone in 15 minutes and prescribing medications?
Generally, no.
Because
it takes longer than 15 minutes to get to understand someone's life story. Diagnoses have to be made in context.
Dr. Carrie Sulkowicz is a clinical professor of psychiatry at NYU and president of the American Psychoanalytic Association.
Psychological diagnoses are almost by definition far more complex, and it requires obtaining both a medical and a psychological and a social history. Just having that kind of conversation takes more than 15 minutes.
But the company's CEO, Dr. David Moe, maintains Cerebral's overall outcomes are positive, as he told us in June.
I would hope that, so I refer my close friends, my family members to use Cerebral. And I would say that it's important to also see the other side of the story, which is the vast majority of our cases where we are changing lives, we're reducing suicidal thinking.
Yet a CBS News review of Cerebral's more than 1,500 prescribers listed on its website found only 5 are board-certified psychiatrists. Most of the rest, some 3/4 of Cerebral's prescribers, are nurse practitioners from specialties outside of mental health.
I find that rather alarming. Diagnosing a mental illness is a complicated endeavor. There's a reason why it takes years of training.
Not only that, this internal log obtained by CBS News shows Cerebral's own staffers flagged at least 280 instances where one patient was prescribed 5+ medications.
These are serious medications that we're talking about. These things are not to be prescribed or taken lightly.
After she attempted to take her life, Yvette was hospitalized and says she underwent a lengthy evaluation with a new doctor who changed her medications.
did your psychiatrist now tell you that when you were with Cerebral, that you were on the wrong medications?
Oh yeah, whenever she got the list of meds that I was on, she's like, I don't understand why they would put you on this.
But now she says she's feeling better.
You know, other people won't see your face, but I can see the relief in your face. I can see it.
Yeah.
And the smile.
Yeah, even though things happened the way that they did, I'm grateful to get the help that I am getting now.
Well, Cerebral declined to answer our specific questions about Yvette's case. In a statement, the company said that its clinical standards meet and exceed those of many conventional brick-and-mortar facilities, and that a highly qualified credentialing team oversees its hiring and professional development of patient-facing clinicians.
It was a really nice interview on a very delicate story, Anna. I'm struck by the data that you were able to produce. They've got 1,500 names listed on their website, but only 5% of them are actually board-certified psychiatrists, and 75% are nurse practitioners with other specialties. I mean, that's concerning.
Outside of mental health.
Yeah, outside of mental health, yeah.
Right. And the company would say to you, look, you know, if these people have questions, they can ask those questions of the psychiatrists. You know, we have a Slack channel if there's any issues that come up. I think that Dr. Salkowitz's point is, you know, it's great to have access to these online mental health services. There's such a need in this country right now, but the devil's in the details, that it's a question of how you handle it. And I think these are some of the questions that are coming up. What we're hearing from some of these patients and some of these employees and former employees is that they have concerns about the way some of these individual cases are playing out.
It's scary to me that she tried to take her own life, apparently, and didn't realize she was doing it. But she was on many medications. How do we know that Cerebral might have played a part? There was many things there that she was taking.
There's a question there of what drugs she was on and whether they were the appropriate medications. Clearly, her new doctor, according to her, believes they were not the correct medication.
The overall mission of making mental health care more affordable, more accessible, more convenient is a good one, but it does have to be done right. Yeah, and it's not even 5%, it's 5 board-certified psychiatrists. Anna, thank you very much. If you or someone you know is experiencing a mental health crisis, please do call the National Suicide Prevention Lifeline. They are always standing by. You can reach them at 988. Again, that is 988.